Good afternoon and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Joining me today are the Minister of Health, the Honorable Terence Dial Singh, and Dr. Avery Hines, the Technical Director of the Epidemiology Division at the Ministry of Health. The Minister of Health, the Honorable Terence Dial Singh, will give you an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good afternoon to my colleague, Dr. Avery Hines. Good afternoon, ladies and gentlemen of the media, and to all citizens in Trinidad and Tobago listening in locally and abroad. Before I get into the usual statistical analysis, I just want to bring the country up to date on two global events that occurred within the past 24 hours or so that should drive home the point that those of us who are still taking COVID-19 lightly, we ought to get the message as of today and treat this with the seriousness it deserves. In one of the international news reports, do you know that one newspaper actually printed 13 pages of obituaries? Think about that. 13 pages of death announcements due to COVID-19 in one particular country. The other major international development is this. There's a very isolated tribe in the Amazon rainforest in Brazil. Isolated, indigenous people. And they had one COVID death. A young boy in that tribe died because of chance exposure with the outside world. Ladies and gentlemen, I just bring these two issues to your attention to drive home the point that what we unfortunately witnessed last night about a COVID party in St. Anne's is what is going to blow up the healthcare system in Trinidad and Tobago. That one act of recklessness is what will cripple our healthcare system, because it takes one person to be reckless to infect 10, and then 10 infect 100, and 100 infect 1,000. Coming into Port of Spain this afternoon, there was a police exercise on the Churchill-Roosevelt Highway. I saw them stop about 10 to 15 vehicles, mainly filled with young men in short pants, what looked to me like beach attire. And every trunk that was open had coolers in them. So they were going to party somewhere. So we are not, some sectors of the country are still not getting the message. And the message is to stay home and to stay safe. I will now proceed to give the statistical analysis of where we are with COVID-19. The number of tests performed so far are 1,090. Over the last 4 days, we did 213 tests over the last 4 days alone. The number of positive cases are 109, and if we take off the 49 from the cruise ship group, we are left with 60, 4 of which are from Tobago. I got a very interesting message from a concerned citizen that why are we always insisting that we take off the 49 from the cruise ship? Are they not Trinidadians and Tobagonians? Yes. For clinical reasons and for treatment, we always include them. They are deserving of our treatment. But we take them out only for statistical analysis, because that 49 cases was what the statisticians will tell you is an anomaly. It's a unique situation that does not add up to the national statistics as far as prediction is concerned. Discharges to date have gone up from 1 to 4. That is some good news. The deaths remain the same, 8, 7 from Trinidad and 1 from Tobago. And the number of people in hospital stands at 98. How is that 98 broken down? We have 26 in Cora. These patients are all moving around. They are well. They are what you call ambulatory. They can walk around. In Couva, there are 72 patients. You have one patient in ICU who is stable and not ventilated. We have 4 people in the high dependency unit, which is a step down from the ICU. 4, and you have 67 stable patients who are able to walk around again, ambulatory patients. We hope to complete by tonight the potential transfer of 30 patients from Couva to a convalescence facility so that they could complete the rest of their treatment and isolation there. In Balandra, we still have 22 persons. I just want to handle some numbers which I promised the media yesterday. One of the questions was, how many patients are still left in the suspected ward at Cora? The number is 6. And one of the other questions that was being asked, how many people, not how many samples, how many people have been tested? We tabulated that number over the past couple of days. The number of people tested is 1,007. So we have 1,090 samples, I am told, which represents tests done on 1,007 individual patients. I want to handle one piece of misinformation, let's call it that, about Tobago. There was a report that some doctor in Tobago was making claims that Tobago isn't following the national plan of having a parallel system and that there was intermingling and commingling of COVID-positive patients with the rest of the patients. Let me say that is absolutely untrue. Tobago is part of the national plan. What they have done with their infrastructure, because they have one hospital, is that they have dedicated a particular ward with a separate entrance that could house between 30 to 40 patients to deal with COVID only. So they are following the parallel healthcare system national plan within the structure that is the general hospital. They also have a dedicated intensive care unit, and they have a separate accident and emergency pathway for people presenting with viral illness symptoms. So there is no commingling, there is no co-mixing with other people seeking accident and emergency attention. Also, the old hospital at Fort George has been reactivated. There are 2 wards there in keeping with the national plan of a parallel healthcare system. So those are the updates that I have for you. I just want to remind people to pay attention to what is happening globally. Let me just repeat. One newspaper, 13 pages of obituaries. 13 pages in one day. And just by way of example, if a tribe in the Amazon can get COVID, let us behave ourselves and heed the warnings of everyone from the Honorable Prime Minister come down to stay home and stay safe. Thank you very much, Minister Cox.
Thank you very much, Minister. At this time, Dr. Avery Hines, the Technical Director of the Epidemiology Division at the Ministry of Health, will now discuss contact tracing. Dr. Hines.
Thank you, Minister Cox. Good afternoon, everyone, members of the head table, members of the viewing public. I am going to take a little time to explain not just the contact tracing, but do a little more of the demographics and the geographics around the existing cases, and then explain the public health measures that have been put in place in terms of how they impact on and hopefully manage to reduce spread. We do have a presentation or a few images that we need to put up onto the screen. So I'm going to ask if those can be projected at this time. So this first graphic really just shows some of the demographics that have been requested periodically during the media conferences in terms of the age and sex distribution of the 109 cases at this point in time. noting that there are a slight preponderance of females over males, and that the red dots on the graph that you may be able to see on your screens, those red dots represent the age groups in which deaths would have occurred, and you'll see that all those deaths occurred in persons above the age of 55 years. The next graphic shows the geographic distribution of the cases. This is the updated graphic that captures all of the 109 cases and shows a distribution that corresponds with the population density, largely, of Trinidad and Tobago, distributions along the east-west corridor down into central Trinidad and in town centers proceeding further south. We have both the maps of Trinidad and Tobago displayed there, and the sizes of the circles represent numbers of individuals within a given geographic area. We did find that where there was a larger number than one per geographic area, it was usually because of intra-family transmission, so clusters of transmission within families in accordance with the fact that they had been quarantined together. This is the update of the geographic spread, and what we wanted to show at this point is the relationship between the public health measures and the reduction of spread at all of the points at which we implemented measures. So the first image, moving on to the next image, this just represents the original situation. Just a moment, I'll wait for them to get back to the one after this and after that. Next. Next should be number 4. Thank you. So this represents the original situation of us having imported cases, and those cases being traced in a particular way so that we identified their contacts, their primary contacts, usually family members, or if they went to a gathering somewhere where they were in contact with other persons, the primary contacts would then extend beyond just family. If a family member or a primary contact moved on to a workplace or a school, then they would be in contact with another group of persons that was considered secondary contacts. And we showed the potential for exposing large numbers of people if we went to houses of gathering. So the first layer of reduction was the reduction in importation with the progressive travel restrictions that were implemented, starting first with the travel restrictions from the most affected countries, moving on to the travel restrictions of non-nationals in general, and culminating with the absolute travel restriction where the borders were essentially closed and no additional persons were allowed to come into country in order to reduce the risk of importation of new cases. If we move to the next slide, we see that when we ask persons who have traveled to quarantine, we create a virtual barrier. Those 3 no-entry signs, as they appear on the screen, show that if we have the travelers quarantined with their families, then we've created a barrier, a behavioral barrier, that prevents spread to the workplace or a school or a place of gathering, whether it is a church or otherwise. Now, what would happen if we did not quarantine? Let's look at the next slide. In the absence of us putting that barrier in place, all of these secondary locations could be contaminated or infected by a potential case, even if the person was mildly ill and unaware of their symptoms. And if, perchance, one of the places of gathering was a cinema or a pub or even someone taking public transport, then it's very difficult to trace back the persons with whom our primary or index case may have been in contact. And for that reason, all of these places of potential gathering were reduced. No gatherings at cinemas, at pubs. We asked people not to come out to work if they weren't members of the essential services, reducing, therefore, the numbers of persons using public transport all in an effort to reduce the risk of exposing people unknowingly. Those hidden contacts, as the CMO would have referred to them on several occasions. This is the layer of protection that asking people both to quarantine and to stay away from gatherings and moving around in general would provide. And what happens if persons don't follow the request, the instruction to stay away from movement and to stay at home? Let's look at the next graphic. What would happen is what the minister has described as a pyramid of transmission. Now, this particular virus seems to transmit itself to between 2 and 3 persons per infected case. So that little R0, R0, or the reproductive number of this virus can be 2 to 3 people on average. So one person may infect 2, either of those persons may infect 2 to 3 more, and so on and so forth. And you see how rapidly one person can actually lead to a large number of cases. And this is just in the average day-to-day setting. This is not someone in a party. This is not someone in a church setting where you are exposed to more individuals, and therefore you form the role, or you take the role of what would be called a super spreader, because you are now spreading to more than the average number of persons that an ill individual would normally be in contact with. So this is why, on top of the reduction in social gatherings, closure of schools, closure of places of usual public hanging or liming as we call it, we've also asked people not to move around unnecessarily. In so doing, we're hoping that we reduce various opportunities for the virus to jump from one person to another. That basically brings me to the end of my explanation and update on the public health measures that we have been implementing and their relationship to reduction of spread.
Thank you very much, Dr. Hines. Members of the media, the floor is now open, and remember to identify yourself and the media house you represent before posing your question. I recognize Guardian Media Limited.
Hi, good afternoon, Minister.
Good afternoon.
Good afternoon.
Annalisa from Guardian, Trinidad Guardian.
Hello.
What I wanted to find out, Minister, you mentioned the potential move to get persons out from Couva to that convalescent facility. You mentioned last week that they're going to be setting up step-down facilities. Can you tell us where this facility is and whether or not the one up at Brooklyn Settlement has actually become operational? And what is happening when you decant these persons from Couva to Cora? What's happening with that in terms of their accommodations? Because I know that Cora can only accommodate so much.
Okay. So the step-down facility will be in Sangre Grande in Brooklyn. But let me just contextualize this. Our primary objective in fighting COVID is to prevent spread and to save people's lives. What we are trying to do in Trinidad and Tobago is that if you get COVID, you get the best possible care at a basic setting, a hospital setting, or a convalescent setting. The government of Trinidad and Tobago will never put any person or community at risk. Let me repeat that. This government will never put any community at risk. All these sites have been carefully chosen to totally insulate those Trinidadians and Tobagonians in their time of need, so that people in the community will not be in contact with them. Stop and think about that. That is the objective. Trinidad and Tobago is one big backyard. We are too small. Stop and think. So yes, we have chosen with care that convalescent facility in Sangre Grande. As the Chief Medical Officer has said, there is absolutely no risk to the community, and these are our brothers and sisters, and in this time of need, they are deserving of our compassion.
Thank you very much, Minister. Newsday.
Hi, good evening. Janelle D'Souza from Newsday. Can you hear?
Yes? Yes, Janelle.
Okay.
Yes, we're hearing you.
So, with the discharges, the 30 to come out, but is anyone being discharged from Chorus soon? And how many are likely to be discharged? Also, I know that this has been addressed previously, but if you could repeat please, do discharged patients have to further isolate when they return
Sure.
home? And what would there be continued medical monitoring?
Sure. Okay. So I can't give you the exact number to be discharged from CUVA. That depends on whether they have symptoms or not and whether their tests come back negative. The answer to your second part of the question, once a person with COVID tests negative, they get their 2 negative results, they can go home, but then they are also asked to self-quarantine out of an abundance of caution for a further 7 days. So I hope that answers your question, Janelle. Okay? Thank you.
Thank you, Minister. I have a question for you from online.
Sure.
Please ask the Minister of Health how soon arrangements will be put in place for frontline healthcare workers to be tested for the COVID-19 virus.
So, frontline healthcare workers, we put that policy in place over about 3 weeks now. So they are being tested. I don't have exact numbers with me, but we treat them as a special population for special care and attention. Let me also say that healthcare workers, and I'm going to use the word tour of duty loosely, who do a tour of duty and give to this country of themselves, we have allocated special facilities for them to spend their quarantine period. One such facility we toured this morning is the hotel at Napa. It's a first-class facility with Wi-Fi, TV. Their meals will be brought in. So any healthcare worker who needs to be quarantined will be accommodated at different sites throughout the country, including Napa.
Thank you very much. 98.1?
Yes, good afternoon. Stephen Cummings, 98.1.
Good afternoon, Stephen.
A question for Dr. Hines and one also for Minister Dayal Singh. Dr. Hines, regarding contact tracing, what benchmarks are we hoping to achieve, say, by the end of April? And what would it take to remove the lockdown, or realistically, should we be thinking long-term lockdown? And this question is also for Minister Dayal Singh. Are you prepared to further review your signed stay-at-home regulations? You mentioned this morning or earlier on today seeing persons who are still not adhering to those stay-at-home regulations.
Okay, so let me take the second part. First. Mr. Cummins, good. WHO has warned countries around the world not to release the pressure valve too soon. If you notice what is happening globally, any country that prematurely releases the pressure, they end up with a second and third wave of infections. We are in our first wave of infections. We don't know when our peak will come. We don't know. So it is premature for me as Minister of Health to advise the Cabinet or the Prime Minister that we need to rescind any regulations. It is way too soon. What will drive it is the virus, how it behaves, but also the main driver is the behavior of people. And that COVID party tells me last night that there are some people in this country who want to see these regulations go on for longer. That police exercise on Churchill Roosevelt Highway where 15 cars were stopped with young men in short pants and slippers and coolers in their trunk tells me that a certain sector of the society wants this to continue for much longer past April 30th. So those are the factors we have to consider. And it is only human behavior at this point in time. If we cut out the recklessness and stay home, then we could start a conversation about that. But at this point in time, that is not part of the national conversation. The national conversation is to stay home, stay safe. Dr. Hines.
Thank you, Minister. In terms of the benchmarking that you referred to or asked about with regard to contact tracing, the main benchmark that we would be utilizing is ensuring that for each individual for whom we have a confirmed COVID positive, we have identified all of the highest risk potential contacts at the primary, secondary, and even tertiary level, and that we have been able to follow up with those contacts in an appropriate manner, monitoring for symptoms and testing as appropriate. So all of those behaviors, all of those actions that we take then align with the international best practice with regard to the containment of a communicable disease.
Thank you very much. Yolande Thomas.
Good afternoon, Yolande Thomas from CL Communications.
Good afternoon, Yolande.
Minister, can you say if you have any statistics before you with regards to the young men that you saw with their short pants and in their vehicles, whether or not, they've been charged or reprimanded? Do you have any statistics?
I was just driving to come to this press conference, and I noticed on the shoulder about 3 police cars and about 10 to 15 cars with civilians, so I wouldn't know who was charged. I didn't stop to inquire. That is quite frankly police business. But it disappoints me that these young men, in the midst of a global pandemic, are not getting the message. It disappoints me. And when you marry that and merge that, when Commissioner of Police was here on Thursday and told the country not to have COVID parties, what happened? There was a COVID party. So these are the people whose behavior will drive the virus far and wide and ultimately delay us making any sort of positive decision moving forward. It is human behavior that is going to cripple this country because the virus piggybacks on humans. Okay? Thank you very much.
Priya Bihari.
Hi, good afternoon, Priya Bihari, AZP News. Before I begin, can I ask the moderator if it's possible for my colleagues and myself if our mics are not muted after we ask the questions, because sometimes we need clarification, and if sometimes our questions may not be answered properly, so we just need some clarification if that is something we can do in terms of housekeeping. My questions, I just have 2 simple questions. It has to do with the sampling. Minister, you said that we have 1,090 samples tested. That comprises 1,007 people. During these press conferences, the CMO has said most times a person is tested twice. So if my maths is correct, it means that only 83 people here have been tested twice.
Okay, so before you go forward, the CMO never said most people are tested twice. The people who are tested more than once will be those who are COVID positive. The majority of people are COVID negative, so they will only be tested once.
Okay, so out of the 109,
yes.
Basically 83 have been tested twice.
84.
84. Okay.
83, 84, correct, yeah.
And how many rejected samples are in this 1,090, if any? Is this sample size of 1,007 people, do you think that is an accurate enough number to give an idea, an indication of the COVID-19 spread in Trinidad and Tobago?
Right. So these are actual samples that have been tested. So this does not include what you might call rejected samples. These are samples that have been tested, 1,090. To answer the second part of your question, is this accurate? That is why yesterday we said we now want to have a wider picture, and what we are doing now is more active sampling in the communities via selected health centers from Tuesday. So we are ramping up testing to see what is out there. H1N1, influenza B, or COVID, and that is how you follow international protocols after you do your first circle of known cases, primary contact, secondary contacts, you then go out into the community. So that type of active sampling from Tuesday will give us a far better picture as to what is happening following international protocols, and will give you a higher degree of accuracy.
Thank you. Prior, are you okay?
I just want to ask one more question, Minister. Can you tell me why would a patient be taken to Cora as opposed to Couva and vice versa? And what about the Augustus Long Hospital? Is that still a place that difference?
Sure. So we have stratified the healthcare system in a parallel system, so we don't treat COVID-positive patients in the regular hospital system. Couva is used as a tertiary setting. These are people who need either HDU, high dependency unit support, to be on oxygen, to be monitored, or intensive care, or other type of hospital intervention. Cora is for the less severe patients, so the suspected patients will go there. Also in Cora, we have 4 isolation units, so they will be 4 people can be isolated there. So it's different levels of care, different levels of treatment. The issue of Augustus Long, that hospital is currently almost close to finished. I was speaking to the person in charge of that this morning, and we hope to get that online by the end of next week. And we will have capacity there for about 50 to 60 persons, if required, at Augustus Long, including ventilators. Okay? Thank you.
Wire 868.
Hi, good day. Lasana Lightwood, Ward 868. Mr. just pointed out that persons who test negative are only tested once, but I suppose Balanja would be the anomaly again, because
correct,
of course
yes.
There you have 22 persons who are already on their third test, right? But no problem. Going to your earlier talk with the president of the Pharmacy Association, you said you were discussing soaring prices and the shortage of certain drugs. Could you update us on how those talks went in terms of the drugs needed for lupus, malaria, and
sure.
so on, and the prices? And also, could you say if there's anything the government can do through maybe the public health ordinance to cap the prices of essential items during this crisis?
Okay. So the government has absolutely no control over prices of pharmaceuticals or food or hardware materials in the private sector. Absolutely no control. But let me just go back a bit. There was this talk that this anti-malarial drug, what's the name of it again, Avery?
Hydroxychloroquine.
Hydroxychloroquine could be used for COVID. There is absolutely no scientific evidence to support it. As a matter of fact, the American Cardiology Society came out 2 or 3 days ago and saying it is absolutely dangerous. It could lead to heart arrhythmias. So the use of hydroxychloroquine or chloroquine, either by itself or in combination with an antibiotic called azithromycin, as we stand now, is of absolutely no use and is potentially dangerous. I had raised the issue because there was a run on hydroxychloroquine and chloroquine in the private sector, where people were storing and hoarding the drug at home, not knowing how to use it, when to use it, and why to use it. That led to an artificial shortage in the private sector, which then disadvantaged 3 groups of people who need that drug for ongoing therapy. Those who use it for malaria, those who use it for rheumatoid arthritis, and those who use it for lupus. So my talks with the president of the pharmacy board, and he was very, very amenable to carrying the message, and he actually told me he was on radio and other media platforms, encouraging pharmacies to do 2 things. 1, not to price gouge, and 2, retain those necessary medications for their loyal customers who need it to treat their ongoing conditions of lupus, rheumatoid arthritis, and malaria. So let me reiterate, at this point in time, absolutely no scientific evidence that that drug is effective against lupus, and the American Cardiology Society has come out and said it is actually dangerous and can cause heart trouble, cardiac arrhythmias. Thank you.
Minister, if I may, just to add to the discussion on hydroxychloroquine, I'm looking now at a study that is still, it's under reviews and it hasn't yet been published, but review of additional treatment outcomes with hydroxychloroquine for persons hospitalized with COVID-19 showed that there's an actual increase in need for respiratory support with no benefit, no change, no improvement on either mortality or any of the clinical indices, any of the things that they would look at, like the white blood cell count, etc. No improvements there, but those people did end up needing additional respiratory support. So just in support of what the minister is saying, as the evidence comes forward, we're seeing less and less potential benefit and more danger with the improper use of these drugs.
New source? Oh, we are not hearing. New source?
No, she's speaking.
She is speaking.
Okay, there we go.
Right.
I've just been unmuted. Good afternoon.
Good afternoon, Rhoda.
afternoon.
Good afternoon. Nice to see you.
Good afternoon, everyone.
Good
So,
afternoon.
yeah, same. I've got two questions, one for Dr. Hines and one for Minister Diallo.
Sure.
Minister, given the fact that COVID-19 is a virus, there are other viruses, there is a potential, or rather I'm assuming, when persons have been tested, because you have more than 1,000 persons that have been tested, and they're coming, and a significant number come back COVID negative, they would have been tested because they exhibited flu-like symptoms. Might it be possible for the Ministry of Health to give a sense of what are the other viruses that people would have been testing positive for?
Sure.
Because I'm assuming that that some of that is taking place.
Sure.
Because if that can be added to the daily updates that are put out, even if it's just the main viruses like SARS and H1N1, I think it would help to give a broader picture of what people are actually contracting and what people are actually exhibiting symptoms for and of alongside COVID.
Okay.
And to Dr. Hines, are there any drugs at all being tested, whether it is locally, regionally, or globally, that will be showing any sort of showing any sort of positive impact on patients when they're being treated?
Okay, so let me take the first part of the question directed to me. So since 2009, when we had the swine flu pandemic across the world, millions of people died. H1N1 has been what you call endemic to Trinidad and Tobago, which means it is part of our flu landscape. So H1N1 and influenza B is always circulated in Trinidad and Tobago. You mentioned SARS. To the best of my knowledge, and Dr. Hines could probably clarify, I don't think we have any cases of SARS in Trinidad and Tobago. No. So he has confirmed we don't have any cases of SARS in Trinidad and Tobago. SARS and MERS were largely contained in the first couple of years of their emergence. And one of the reasons is that they were much more lethal than COVID. So those persons actually, unfortunately, died before they could spread it. What is dangerous about COVID is that most of it is so mild that you don't know you have it and you spread it. But Dr. Hines will go in there. So our influenza landscape in Trinidad and Tobago is the common cold, everyday garden variety common cold, plus H1N1, plus influenza B. As to giving you those details on a daily basis, that is going to be difficult at this point in time because the common cold affects 100,000 people in Trinidad and Tobago every year. We don't have records of that. That is not a recordable virus. What we do record are confirmed cases of H1N1 and possibly influenza B. We might be able to include that if it doesn't put too much a strain on us right now. But we have the vaccines for that, so that is why that is not a major problem. You have a vaccine for H1N1 and influenza B. We don't have a vaccine for COVID. Dr. Hines.
Okay, thank you for the question. With regard to additional medications being tested, I know that they are looking at various antiviral medications already in use for flu and for other viral illnesses, and they're also looking at some medications that influence immune function. Now, there haven't been any really conclusive outcomes on any of those drugs at this point in time, but a lot of work is ongoing looking at the potential utility of other antivirals and immune modulating drugs in the context of treating COVID-19 patients. Thank you.
Thank you. 91.9.
Hi, good afternoon.
Good afternoon.
For the next over here from 91.9 FM. Just two quick questions. Dr. Hines, could we get an idea of the rate of transmission through primary, secondary, and tertiary means, like a percentage, how prevalent it is as opposed to imported cases? So if you get a percentage of imported cases versus those other type of infections. And also, Minister Dayal Singh,
yes,
I got some information right before the press conference that we are not conducting autopsies at all at the moment. Is that true? Is that confirmed?
Yes, so that question was posed to the Chief Medical Officer already, and he indicated because of the potential danger, autopsies on people who have unfortunately passed from COVID-19 will not be done, and that is under the protocols developed by the Chief Medical Officer following WHO guidelines.
Not with respect to COVID-19 patients alone, I was asking in general, is that no autopsies at all are being done?
That is not correct, sir. Only for COVID-19 patients.
Only for COVID.
Thank you
very much.
Okay, to take the other component of the question, I'm not sure if you're asking about that rate of transmission from a wider population perspective or just within the cohort of persons that were tested and found to be positive. But what we did find is that the vast majority of the cases that we have confirmed have been persons with a primary or a direct travel history, and in a very small number of cases there has been the transmission to family members, or in cases where they actually did not self-quarantine or self-isolate, members of their work group may have been exposed, but those were in the minority. Do not have a percentage because we didn't calculate it in that manner, but the vast majority were direct importations with small clusters of transmission to family members in a few cases, not very many.
TTT? Is TTT on?
Hello. Hi. Good day.
Good day.
I've got a report in one of the newspapers in the UK where coronavirus is affecting the brain and other neurological orders. Now, I know a lot of Trinidadians, a lot of people on the whole are saying that I'm 20, I'm 30, I'm 40, I could survive, I may not die, and they may tend to be careless. Mm-hmm. Now, what would you say to someone with these new reports coming out from different countries where coronavirus is affecting people differently?
Dr. Hines.
Okay, thank you for the question. There are lots of reports coming out on a wide variety of outcomes. Some of them have not really been verified, so I can't speak directly to the ones that you have mentioned. But what we do find with new viruses in particular is that they can affect systems other than the target system. So with dengue, they found that there was the potential for neurological impact. With Zika also, neurological effects were seen. I would not be surprised if this new virus, COVID-19, can do things other than affect the respiratory tract. And as actual consensus is formed on those reports, then we'd be better placed to make a statement on the likelihood of having neurological or other impacts. At this point, it's still what they call anecdotal, meaning there's a story or report here or there of that kind of effect. But to take the second part of your question, which is very, very important, we cannot, under any circumstances, take the position that, well, we are young, I'm 20, I'm 30, I'm 40, and therefore I am healthy and robust and will not be badly affected by a COVID-19 infection. Some people are unaware of comorbidities that they may already have at 20 or 30 or 40. There are persons who do not know that they are hypertensive or do not know that they're diabetic because they haven't yet been diagnosed, and these persons would be in a higher risk group for severe outcomes, in spite of the fact that they don't know that they have a comorbid illness. So we really want to encourage all persons of all age groups to take the warnings seriously and to stay out of harm's way. Stay indoors as much as you can, stay out of gatherings, and reduce your risk of contracting COVID-19. Thank you.
Thank you. TV6.
Good afternoon, Elizabeth Williams, TV6 News.
Hello, Elizabeth.
Hi, and a happy Easter Saturday to you
Same
all.
to you. How is Tobago?
Thank you.
Tobago is wonderful,
Lovely.
Minister. Sunny skies. I have several questions, and I'll ask all of them now. In terms of there's a water problem in the country in some areas, we have received a number of reports with respect to Saddle Road in San Juan and even in Tobago, where a number of villages are complaining that in light of COVID-19, they are unable to wash their hands properly, especially as advised by Minister Dayal Singh. Also, at the Arima Hospital, one patient is saying their tests were done for COVID-19 since the 30th of March, and they were told they would be contacted by the Ministry of Health, and today they have not received any results. This patient is wondering what is the next course of action. There is also a problem. I know that most likely Minister Dayal Singh would say that Minister Camille Robinson Regis will have to answer, but I'll still ask it. In light of grants for the people of Tobago and the food cards, many Tobagonians are complaining that up to now they have received no food cards. And they are saying this is contrary to in Trinidad, thousands of persons have been receiving cards. Also, Minister Dayal Singh, are you feeling a sense of hope that more persons will be discharged soon? And also firefighters, at the Crown Point station, they are complaining that in light of COVID-19, they are working under severe conditions and not environmentally friendly conditions. And my final question, Minister, and also those on the panel, I don't know if Dr. Hines will be able to answer this question. Cambridge University researchers mapped the genetic history of COVID-19 infection from December to March and found 3 distinct but closely related variants. In light of this, has CARPHA identified which version of the coronavirus was found in local samples? Thank you so much.
Okay, Elizabeth, so you asked 1, 2, 3, 4, 6 questions here. So let's take them one by one. With the issue of water, I will certainly look into it with Minister Lehunt. The question of that patient in Arima, if you, again, I will always be at a disadvantage with individual complaints. What I could tell you, Elizabeth, if you send it to me, I will certainly have it investigated and see if you and I could work collaboratively to bring some ease to that particular issue. And you are right, on the issue of grants, that question I will defer to Minister Camille Robinson Regis. You asked if I have hope that people are being discharged. Whenever I have hope that people are being discharged, and then I am brought crashing down to earth when I hear about a COVID party or see those people being detained by the police. So whatever hope I have is always dashed by the irresponsible behavior by certain people. Even in my community where I live, I still see people outside in the afternoon exercising, riding, running, walking where I live. some people are just not getting the message. So my hope is tempered by sadness when I see irresponsible behavior. On the question of your firefighters in Scarborough, I will certainly bring it to the attention of the Minister of National Security. Dr. Hines, over to you.
And on the topic of the last question, very interesting, the evolution of any virus is usually quite rapid. The identification of 3 separate but closely related strains is information that we do have. What we cannot necessarily identify using the equipment at our disposal is which substrain we currently have within the Caribbean. All we do know is that we do have the correct primers, that is the genetic material that is used to identify or to pick up the COVID-19 virus in circulation in the population that we currently have. So while the closely related strains may have slightly different genetic makeups, we do know that we currently do have the correct correct genetic material to pick up whatever's in circulation where we are. But we will actually inquire as to whether additional information can be made available on which of the substrains may actually be in circulation at this point in time. Thank you.
Thank you. Ladies and gentlemen, we are out of time, but let us get a closing statement from the Minister of Health, the Honorable Terence Dialsing.
Thank you very much, Minister Cox. In closing, I want to particularly thank 2 groups of people in this fight of COVID-19. Healthcare workers, you have risen to the challenge and you have exemplified what is best in the public service. Thank you, thank you, thank you. I also want to thank the media. The media has been doing an exceptional job in getting out the information and spreading the information far and wide. It is this collaboration between all sectors of society, civil society, the media, that will help us overcome this current pandemic that we are unfortunately a part of. Let us heed the warnings and the advice of the Prime Minister. The Honorable Prime Minister has the best interest of everyone at heart. And let us treat all our citizens with care and compassion in their time of need, when they need to be treated in these convalescent facilities. We are all in this together. If we stand united, we will overcome this burden. Thank you very much, and I wish Trinidad and Tobago a holy and spiritually uplifting Easter. Thank you very, very much.
Thank you very much, Minister. And we have come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, we want to say thank you to everyone who has been observing the regulations put in place to protect Trinidad and Tobago and to stop this awful virus from claiming more lives and compromising our health. We know it is a trying time for all, and we wanted to let you know we appreciate your patience and discipline in following the rules. Your actions have directly contributed to the success we have had in Trinidad and Tobago so far. The government does not take this for granted. Please continue your good work. And for those who have not taken this seriously or do not understand the gravity of the situation, we are appealing to you to stay indoors and save lives. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.